And welcome back to the show. We have a new guest next. Dr. Scott Putney is here. He is with the AdventHealth Palm Coast Orthopedic and Sports Medicine Group. He's their hand surgeon. He's here to talk about new improvements in hand and wrist surgery. Welcome to the show, Dr. Putney.
Thank you, Jan.
You know, I was anxious to have you on. You are a new doctor with the practice. Tell us a little bit about your background, Dr. Putney.
I was born and raised in Virginia, and then throughout my medical training, I did my initial training in Richmond and then came to Jacksonville to do my residency.
Okay.
And during my time there, I met my wife, who is a Florida native, and finished training, moved back to Richmond, was in private practice there for a few years, but we were anxious to get back down to Florida. This was a great job that became available, and we jumped on it.
Super. And so you're here at the AdventHealth Palm Coast facility, and you are their hand surgeon. You do hand, wrist, and all the way up to the shoulder. Is that about right as far as surgery?
Pretty much. So I specialize in upper extremity orthopedics for everything except the shoulder, so just below the shoulder to the fingertips.
That works. And I understand there's some new optics and microscopes, and so tell us about the new advancements in technology in your field.
Sure. It's actually an exciting time to be a hand surgeon because there are a few things that have come up over the past decade or so that have really changed the way we're able to deliver care. Mm-hmm. First of all, the ability to do microsurgery has improved greatly. The optics on new microscopes and the instruments that are being fabricated for microsurgery have come a long way and allowed us to do surgery on really minute blood vessels and nerves in the hands that previously were not something that we could treat. And we have those capabilities here, and it's really changed the way that we're able to provide care for people with vascular and nerve injuries to the fingers.
Super. And you also have ultrasound now. Tell us about how that interacts with having, a diagnosis on your hand.
Sure. So we are able to do real-time ultrasound within our clinic, and that has several advantages. The biggest advantage from a diagnostic standpoint is instead of taking a snapshot picture like an X-ray or an MRI would, it allows for a real-time moving picture. So, for example, I can hold the ultrasound over a patient's finger and have them move the finger and watch the internal structures move in real time, which has really improved our ability to diagnose previously difficult-to-diagnose conditions. Okay. And the second advantage is of convenience to the patient and to the doctor, which is allowing for the diagnosis and the imaging to be performed at the bedside at a regular appointment. So you can come in for your first clinic appointment and get an ultrasound and get a diagnosis before you leave the building, whereas previously those people would have to be scheduled for an MRI, receive the test, and then come back again to have an interpretation.
Right. That's really great. And it's, I would assume, more time efficient for not only the clinic, but for the patient as well.
Absolutely.
Super. And you have some new procedures also where you can have hand surgery while being awake. Tell us about that.
Right. So the procedures haven't changed too much, but the way we're able to provide them has changed. In the past decade or so, hand surgeons as a community have started to recognize the value of doing surgery with numbing medicine only, which is great for a few reasons. The numbing medicine makes patients not feel it at all, so there's no pain involved in surgery, just as you would expect. But in the absence of general anesthesia, we remove the risks of anesthesia, which makes surgery safer, especially for older patients who may have medical problems.
Sure.
And it also allows for the patient to move their hand or fingers during the surgery. For example, if we're repairing a cut tendon, I can do the repair at the time of surgery and then have you make a fist to ensure that the repair is strong enough to tolerate that, which has allowed for much accelerated rehab protocols and really provided better outcomes for our patients.
Super. And, if someone out there listening is having problem with their hand or their wrists, what's the best phone number for them to call to make an appointment with your practice?
So they can call us at area code 586-1910.
Super. You know, Dr. Putney, I know you're a busy man. Thanks for calling in today. We appreciate you taking the time. Please come back on anytime and update us on the new improvements for hand and wrist surgeries.
Thank you, Jan.
And that's Dr. Scott Putney with AdventHealth Palm Coast, orthopedic specialist and sports medicine. If you would like an appointment, please call 386-586-1910. And that'll do it for this segment.